Hello, I'm introducing you now our 6D action massage device. We are going to do a massage with the 6D action device, a treatment that accelerates the lymphatic flow, blood flow. We reduce pain and get edema swelling away, and also if we have some adhesions or scar tissue. We have a patient here who's 23 years old, and I'll show you the treatment, how it goes. So always you use as big cup as possible for the area that is treated. And now I will show you how we do the basic treatment protocols. So you can do a pulsation treatment, which is this. This is the activation of the lymphatic knots that you always start the treatment with. You can do this treatment, the basic pulsation treatment, having the patient lying on their stomach or their back. And you do 3 times in one spot the pulsation, opening the lymphatic knots on both sides. And the pulsation frequency is about 1 second, which is the most commonly used. You can use it from 0.1 to 3 seconds interval, but 1 second is the most commonly used. So this is the pulsation technique, and we are doing the activation of the subclavicular fossa as a starter for the treatment. And this is what you do always, whatever you do, the treatment area is. Then the second technique is lift and twist. Lift and twist. So you do the lifting while the pulsation mode is on, or you can just simply do it with a continuous mode, and then you have a continuous suction mode on, and it's very easy to lift and twist the tissue. So this is the second. The third one is the gliding technique, and the gliding technique is done with a regular cup. You adjust the pressure level so that it glides nicely on the skin. If the pressure is too high, the cup won't move on the tissue. So adjust the level. You can help with the other hand by pulling the tissue on the opposite direction. So this is the gliding technique, the third technique. You can also use for the gliding technique the roller cup, which has a roller, metal rollers inside, and moves very easy on the skin. And with the roller you can adjust the pressure higher. So when you have done the opening, you do the spine opening, activation of the spine, and you can do it with the first with the pulsation mode. Three times on one spot, and then you take another one for 3 times. You go all the way to the low back and then you come back towards the neck. You can do also gliding technique with the straight lines. Or with a kind of like a S curve. When you do the whole torso, whole body activation, you follow the water line, so to speak, that the upper left corner you push with the gliding technique towards the armpit. The upper right level you go towards the right armpit. The lower part you go towards the groin area on each side. So we continue the treatment. With our patient, the problem is the operation done on the left shoulder, and if we do the active lifting of the arm, we look the range of motion. So the actively it goes about to 90 degrees. After that there's pain, there's lots of tension, possibly a scar tissue underneath the scar or adhesions, and we try to release those and get less pain and also bigger range of motion. The arm treatment, we start by activating the armpit, and we go into the armpit where there's lots of lymphatic nodes, and we do around 15 pulsations. After that, as the armpit has been activated, you start from the up, from the shoulder, going towards the hand, and again 3 times pulsation, and then the other spot for the cup. On the arm, the more important is the medial side, where the lymphatic veins are more active and more transporting the fluids into the subclavicular fossa area. On the arm, you go all the way to the hands. And then you start coming back. You can do also for the arm a gliding technique. gliding technique is mostly done without the pulsation and with a pressure that the cup glides nicely in the arm. And we go towards the center of the arm and the body. But here, what we mostly want to do now is to concentrate into the area where the operation has been done. And we do the treatment on top of the scar by pulsation technique. We do lifting and twisting. Also without the pulsation mode. You don't cause any pain or irritation while you are treating, so that is the limit for the treatment. If the cup is sucking too hard, you can release the cup by pressing on the edge of the cup with your finger, and it releases very nicely. You can also treat the pectoralis muscle, as that might be also stiff. And then you end the treatment always with the activation of the subclavicular fossa. Once again around 15 pumpings per side. when you are done with the treatment. Thank you very much.